Welcome to UNC Center for Transplant Care, Kidney Transplant Patient Orientation. We will discuss treatment options, patient and transplant team responsibilities, medical evaluation, the waiting list, getting an offer, the transplant surgery and hospital stay, post-operative care and concerns, and living kidney donation. Treatment options for kidney and pancreas failure. Dialysis, peritoneal dialysis or hemodialysis for kidney failure. Transplant, kidney transplant. This does not cure kidney disease, it is a surgical treatment. Pancreas transplant. This may eliminate the need for blood glucose lowering agents. Continued medical management. Insulin medication for pancreas failure, diabetes, pancreatic islet cell transplant. Supportive care and treatment to manage your symptoms of kidney failure without dialysis or transplant, or no treatment. Who can receive a transplant? Patients with kidney disease and already on some form of dialysis, patients with kidney disease not yet on dialysis, but whose kidney function is low enough to benefit from transplant, and patients with kidney failure and type 1 diabetes may be eligible for kidney and pancreas. Medical surgical risk of kidney and or pancreas transplant. These include, but are not limited to, lifetime use of medications to suppress the immune system, organ rejection or failure that may lead to the need for retransplant, fluid collection at or around the transplanted organ, urine leak, bleeding requiring a blood transfusion, infection, wound separation, numbness around site of incision, blood clots, pneumonia, abnormal heart rhythms, cardiovascular collapse, multi-organ failure. A rare risk of any procedure performed under general anesthesia include heart attack, stroke, or death. Psychosocial risk of kidney and or pancreas transplant include, but are not limited to, depression, post-traumatic stress disorder, generalized anxiety, anxiety about being dependent on others or having feelings of guilt, concern about ability to get medical, disability, and or life insurance in the future. Benefits to transplant are no more dialysis, more energy, fewer diet and fluid restrictions, and reducing or eliminating certain medicines. Types of transplants: living donor kidney and deceased donor kidney. In living donor kidney, the donor can be related or unrelated to you. The blood type compatibility may or may not matter. Surgery can be planned, no long waiting time for the recipient. Deceased donor kidney. It comes from someone who has died, must be blood type compatible, and it's unplanned, can be any time, and it's a long waiting list. Rights and responsibilities. The patient must have a series of tests and consults to determine candidacy, must attend all appointments as scheduled or notify team if unable to. Once placed on waiting list, must understand that if health or financial status changes, the patient may have to be reevaluated, placed on hold, or removed from the wait list. The center must help the patient schedule required tests and consults, will use the evaluation results to make a decision to add patient to wait list, determine patient is not a candidate, or determine more testing is needed to make a decision. Will communicate the decision to the patient. SRTR, the Scientific Registry for Transplant Recipients, publishes each transplant program's current outcomes, survival rates, and waiting times online at www.srtr.org. The most recent UNC data is in the packet you received today. It compares our average outcomes to the national average outcomes and what Medicare expects. This data can be used to periodically review UNC's performance. It is updated every 6 months. Your nurse coordinator will be able to answer any additional questions you may have. Evaluation. The recipient evaluation starts with orientation class, lab work, including blood and urine, chest x-ray, EKG, ultrasound, CT scan, transplant nephrologist, transplant surgeon, transplant financial coordinator, pap and mammogram for females, social worker consult, cardiac testing if required, colonoscopy if required, psychologist if required, and other consultations may include medical or surgical specialist, dietitian, pharmacist, etc. Lab test, tissue typing. A special blood test done during your evaluation that identifies antigens in your blood. There are 6 antigens in your blood. These antigens are used to match a deceased donor kidney to you. None of your antigens have to match your donor, but if a donor is found that has the same 6 antigens you do, that is a perfect match. Lab test, PRA, panel reactive antibody. Your PRA is a measurement of the level of antibodies present in your blood. Antibodies are produced anytime we have something foreign in our bodies, such as a previous transplant, a previous pregnancy, or previous blood transfusions. PRA can fluctuate and will be measured every 1 to 3 months once you're placed on the waiting list. A high PRA, greater than 30%, may make finding a suitable kidney donor more difficult. PRA range is from 0 to 100%. The social work visit. The social worker discusses the following with you and your support person, which is required: post-transplant assistance with meals, bathing, dressing, and other tasks until patient recovers. You will need a primary and a secondary caregiver. Finances for payment of hospital and medication copays. Prescriptions for immunosuppression and related costs. Transportation to UNC for scheduled post-transplant appointments. The person driving you must be able to bring you to UNC anytime, day or night, for unexpected or emergency visits, or if you must be readmitted. Psychologist visit. Part of the transplant evaluation for most candidates. At the psychologist visit, you will discuss the following: general health and dialysis history, talk about how you are taking care of yourself, mental health history, alcohol and drug use history, social history, education about how transplant might affect your mental and emotional health. Barriers to evaluation and transplant. Medical issues such as cancer or advanced heart or lung disease. Non-compliance with dialysis, medications, or appointments. Current use of illegal drugs. Not having a support person before and after transplant who can attend visits, drive, and stay with you 24/7 after the transplant for 4 to 6 weeks. Obesity, increased BMI. BMI guidelines. BMI 34% or less, no additional consults required. Proceed with standard evaluation. BMI 35 to 40%. Transplant dietitian consult required in addition to standard evaluation. BMI 40.1% or greater. Evaluation with transplant dietitian and nephrologist only, and possible consult to GI bariatric clinic. Full evaluation, testing, and consults will not start until BMI is 40.0% or below. Goals will be set with resources and support from dietitian. A 6-month reassessment will be done to either continue or close evaluation. Can I continue smoking? This will be decided on a case-by-case basis depending on the patient's medical issues and smoking history. Even though not required for all patients, it is strongly recommended that you stop smoking and use of all tobacco products. Research has shown that smoking after receiving a kidney transplant is associated with an increase in heart disease, cancer, loss of the transplanted kidney, and death. How long does this evaluation take? Length of evaluation process varies from patient to patient. Abnormal test results or problems with appointment availability may delay process, as will missing scheduled appointments. You are not on the waiting list until your entire evaluation is completed, and you are deemed an acceptable candidate by the transplant team. The waiting list. Once you complete evaluation and have been approved by the transplant team, you will be placed on the waiting list for a deceased donor kidney. The average waiting time in this area can be 4 to 8 years depending on your blood type. You will be required to come to UNC for reevaluation every 1 to 4 years while waiting for transplant, depending on your blood type, waiting time, and other factors. If at any time while on the waiting list you have significant changes to your health, social support, insurance, or you fail to complete your required reevaluation testing and appointments, you could be removed from the waiting list. There are approximately 800 people on the UNC kidney transplant waiting list. UNC currently performs approximately 110 plus kidney transplants per year. In the United States, there are 58 organ procurement organizations, OPOs, which are managed by United Network for Organ Sharing, UNOS. Their job is to increase organ donation awareness, coordinate the process of organ donation on a more local level. In North Carolina, there are 5 kidney transplant centers or hospitals. They are divided into 2 organ procurement groups or regions. One is Carolina Donor Services, CDS. They manage the list for UNC, Duke, ECU, and Wake Forest Baptist hospitals. The other is Charlotte. They manage the list for Carolinas Medical Center, CMC. Therefore, UNC, Duke, ECU, Wake Forest Baptist hospitals share a region and are essentially considered one list. The match run list that is generated when there is a kidney offer in our area can include patients from all 4 of these hospitals. Also, there's no benefit to be enlisted on more than one list within the same region. You could, however, list at multiple centers in separate regions. Example, listing at UNC and CMC in Charlotte. Getting an offer. When a kidney becomes available, first the donor gets a score. The first part of the scoring system is for the donor. Every deceased donor kidney gets a score called a KDPI, Kidney Donor Profile Index. The score is an estimate of how long the kidney is likely to work when compared to other kidneys and is based on the donor's age, height, weight, cause of death, medical history, and lab values. A kidney from a living donor is expected to last 12.5 years. A kidney with a KDPI 0 to 20% expected to last 11.5 years. A kidney with a KDPI 21 to 85% expected to last 9 years. A kidney with KDPI 85 to 100% is expected to last 5.5 years. This requires signed consent from the patient. Second, the recipients get a score. The second part of the scoring system is for the recipient, you. It is called EPTS, Estimated Post-Transplant Survival. This score is an estimate of how long the recipient will need a kidney to work when compared to other candidates. It is based on the recipient's age, time on dialysis, and diabetes status. The lower the EPTS score, the longer a recipient will need a working kidney. For example, a person with an EPTS score of 20 will need a kidney longer than a person with an EPTS score of 90. The KDPI and EPTS calculation. Once both scores are calculated, UNOS creates a match run list. Kidneys with KDPI score of 20 or less will be first offered to patients that need a transplant to work the longest, those with an EPTS score of 20 or less. If not accepted by these recipients, it will then be offered to others that match the donor by blood type and antigens, regardless of the EPTS score. The kidney allocation pamphlet in your packet will explain in more detail, and your physicians and nurses will review this with you during your evaluation. When your name comes up, the on-call nurse coordinator will call you, ask how you've been. Have you been sick? Hospitalized? Are you on antibiotics? If you have been sick or on antibiotics, you may not be eligible for the kidney transplant. Surgeons will not perform the transplant if you are sick. The on-call nurse coordinator will inform you of the kidney offer, will identify where your name is on the match run list, and will develop a plan. This plan may involve waiting at home until we call you back, or we may ask you to come to the hospital. You have the right to refuse a transplant at any time. If you are asked to come in, you will be told where to report at UNC Medical Center. You'll be assessed by a nephrologist for medical clearance and by a member of the surgical team for surgical clearance. You will have testing done, such as a chest x-ray, an EKG, and lab work. One of the first lab tests we need to do is called a cross-match. The cross-match. This is a blood test done between the donor, living or deceased, and the recipient. This mixes the donor and the recipient's blood and looks for a reaction. We want no reaction, a negative cross-match. A positive cross-match means there is a reaction. You may not be able to receive a transplant from this donor. Who gets the organ? The first person on the match run list who receives medical surgical clearance and has a negative cross-match gets the kidney or kidney pancreas. Unfortunately, this means some people are brought into the hospital, wait several hours, and then are sent home without a transplant. Risk in the donor. Efforts are made before transplant to find risk in the donor. These risks may include, but are not limited to, the donor's history, donor's condition at time of death, donor's age, any undetected infectious diseases. The donor will have many tests done to look for these risks. It is rare that any disease will be passed along from the donor organ, but it can happen. Public health services increased risk donors. Increased risk social behaviors such as IV drug use, time in prison, or other risk factors. Many tests done to determine if donor has infectious disease prior to donation. You will be notified at the time of the organ offer if the donor is a PHS, Public Health Services, increased risk donor. You have the right to refuse this type of donor offer. Hepatitis C donors. You could also be offered a kidney from a donor that is hepatitis C positive. New drugs are available since 2013 that are very successful in curing hepatitis C. Organs from hepatitis C organ donors have been used with 95% or better cure rates. You would have to sign a special consent. You would be tested often after transplant and would be given medications to treat the disease if necessary. Hepatitis B donors. This donor would be a hepatitis B core antibody positive, meaning a past or current hepatitis B infection. Risk. Very low to no risk of transmission if immune. Your criteria as recipient. Lab result hepatitis B surface antibody reactive, meaning you received the hepatitis B vaccination and are immune. At the time of the organ offer, you will be informed of if the donor is hepatitis B core positive. Post-care. Monitoring of your blood work. If change is noted, medication and monitoring will be necessary. There is no current cure for hepatitis B. No signed consent is needed for this option. Now we will discuss surgery and hospital stay. The kidney transplant surgery. Length of surgery is approximately 4 hours. There's an open incision is made in the lower abdomen, kidney placed inside the right or left hip bone area. The ureter from the donor also is connected directly to your bladder. Your native kidneys are not removed at the time of transplant. This is a picture of the diseased kidneys, your transplanted kidney, and then your urinary bladder. The pancreas transplant. An open incision runs from your belly button to right above your pubic bone, a midline incision. The pancreas is usually placed on the right side of your belly. The vessels of the new pancreas are sewn to larger blood vessels veins, and arteries. It is also connected to a portion of your small intestine so it can drain digestive juices. Your own pancreas is not removed. A combined kidney pancreas surgery. If you have a combined kidney pancreas transplant, the surgery may take 3 to 6 hours, and both of the organs are put in through a midline incision. The pancreas usually goes on the right side and the kidney on the left. For all procedures, the skin incision will be closed using staples. The staples will be removed during a follow-up clinic visit about 4 weeks after transplant. A gauze dressing will be put over the incision to keep it clean and absorb any drainage, which is normal. Post-operative care. After the surgery, you will be in the ICU for the first 1 to 2 days. This is our intermediate step-down care unit. You will have an IV, oxygen, EKG, a urinary catheter, JP drain, blood pressure monitoring. We want you out of bed as soon as possible, and education begins as soon as possible. You and your support person will learn about diet, medications, activity level, wound care, avoiding infections, assessing problems. Your average length of stay in the hospital is 3 to 7 days. Possible early complications. Approximately 98% of transplanted kidneys work right away. However, some do not. You may need some dialysis. You could have some rejection and will need IV medication, and the possibility of returning to the OR if there is a technical problem. At discharge, you will be able to identify problems and know who to call and when. You must have your support person or persons identified to help you and stay with you at home, provide care, and drive you to appointments. Arrangements for your prescriptions and lab work will be finalized. Labs will be drawn locally 3 times a week and eventually will taper down to monthly. Clinic visits with the surgeon. First visit is 2 to 7 days after discharge, then every 1 to 2 weeks, eventually will taper down to annually. Postoperative complications. Infection. You are at higher risk due to immunosuppression. Avoid sick people when possible. Hand washing is very important, and learn to recognize the signs and symptoms of infection. Rejection may be acute or chronic and has varying degrees. Can be treated in most cases if caught early. This may require hospitalization for biopsy and/or IV medication. Frequent lab tests are required as signs and symptoms may be difficult to recognize. Medications. Anti-rejection meds will be needed for the rest of your life or the life of the kidney, in addition to other medications. Possible side effects: nausea and GI issues, hand tremors, increased risk for skin cancer, and may develop diabetic changes. Your responsibilities after transplant include following all medical advice, getting lab work, and attending clinic visits as the transplant team recommends. Notify your transplant team of any problems or concerns. Take all medications as prescribed. Do not stop or add any medications without permission from the transplant team. So what can I do now? You can get a pap smear, get a colonoscopy, get a mammogram, get copies of any other tests done locally and send them in. Vaccinations up to date? Sign up for my UNC chart. Be sure your home and mobile phone voicemail is set up and functioning. My UNC chart. It is recommended that you access my UNC chart. You're able to message a provider in private, manage appointments, access test results, refill prescriptions online, obtain proxy access for family member, pay bills online, get started before visit, download our mobile app, instant activation for quick sign up. UNC staff will be happy to help you sign up for My UNC Chart. You can go to myuncchart.org or call 888-996-2767. UNC Health Link. Welcome to the UNC Center for Transplant Care. Living donors. Why do I need a living donor? There's no wait list, you're transplanted quicker, it works better, and lasts longer. How do I find a donor? Share your story with friends, family, and community. Explain your need for a transplant and that living donation would likely provide you with the best outcome. Identify a family member or friend to be your champion. This person can talk to others on your behalf. UNC offers champion training classes several times a year. Send a letter, email, post on social media. There are apps to help you write out your story. UNC can assist with that once you are on the list. The donor process at UNC. The donor must make first contact. Call, email, or visit website. Donor reads information about the donor evaluation, surgery, and recovery. The donor completes a medical questionnaire and sends it into the donor coordinator by mail, email, or website. The UNC donor coordinator reviews questionnaire with doctor for contraindications, things like diabetes, sickle cell disease or trait, rheumatoid arthritis, lupus, history of cancer, active drug use, and obesity, a BMI greater than 30%. The donor process at UNC continued. If questionnaire is acceptable, the UNC obtains insurance authorization to start testing. The recipient's insurance pays for donor evaluation test, surgery, and hospital stay in most cases. Once authorization is in place, the donor and recipient will be scheduled for initial blood test only to check compatibility. The initial donor testing. Blood type compatibility. These are compatible blood types. If you, the recipient, is A, you can have a donor A or O. Recipient B, donor B or O. Recipient AB, donor A, B, AB or O. Or recipient O, donor O. If your living donor does not have a compatible blood type with you, we may offer you ABO incompatible transplant. Cross-match compatibility. Negative cross-match, no reaction between the recipient and donor. Positive cross-match, there is a reaction between the recipient and donor. If you and your living donor have a positive cross-match, we may offer kidney paired donation as an option. What's next? If the donor moves forward, they will be scheduled for full evaluation. The donor evaluation must be at UNC and takes 1 to 2 days to complete. The donor evaluation. Donor has labs, x-rays, CT scan, doctor visits. The donor is educated educated about the risk of donation surgery. Once results of all donor testing is complete, it is reviewed by the donor committee and a decision is made. If a donor kidney function is good and the team feels it is safe for the person to donate, they will be approved. If a donor is approved and they want to proceed, surgery will be scheduled for a time agreed upon by the donor and the recipient. The donor surgery is done laparoscopically, smaller incisions, quicker healing time. The donor is usually in the hospital for about 2 days. The donor will have to stay locally, within 2-hour drive of UNC, after discharge from the hospital, until seen for the first post-op visit 8 to 10 days after surgery. How donors can get started. To get started or to just ask questions about donation and learn more, please have any potential donors contact Amy Woodard. Her phone number is listed there, her email contact, and our website, www.uncmedicalcenter.org/livingdonors. Thank you and welcome again to the UNC Center for Transplant Care.